Welcome back to Anatomiqa. In this session, we will be discussing on the details of the back of thigh, including the boundaries and contents. The learning objectives of this session are: enumerate the characteristic features of the hamstring muscles, describe and demonstrate the attachment, nerve supply and actions of the hamstring group of muscles. The posterior compartment of thigh contains a group of muscles where the tendons of these muscles are found in the region of ham in the lower part of the back of thigh called popliteal region. Because of this, the muscles are called hamstring muscles. Back of thigh extends from gluteal fold above to the back of knee below. The cutaneous nerves supplying the back of thigh are posterior cutaneous nerve of thigh. From medial side, cutaneous branches of the obturator nerve, medial branches of anterior cutaneous nerve of thigh, and from the lateral side, branches from lateral cutaneous nerve of thigh. Coming to the boundaries, the thigh is divided into three compartments: bilateral intermuscular septum, medial intermuscular septum, and posterior intermuscular septum, which are extending from the deep fascia of the thigh. The posterior intermuscular septum is incomplete because adductor magnus is an hybrid muscle formed by the fusion of flexor and adductor compartments. The compartment present between the deep fascia of thigh, lateral and medial intermuscular septum is the anterior compartment. The compartment present between the medial intermuscular septum, posterior intermuscular septum and deep fascia is the medial compartment. The compartment present between the posterior intermuscular septum, lateral intermuscular septum and deep fascia is the posterior compartment. The boundaries of the posterior compartment are: the floor is formed by adductor magnus and vastus lateralis, which is covered by lateral intermuscular septum. The roof is formed by fascia lata, which is nothing but deep fascia covering the back of thigh. Contents of the posterior compartment are semimembranosus, semitendinosus, long head of biceps femoris and ischial part of adductor magnus, which belong to the hamstring group of muscles. Then short head of biceps femoris, sciatic nerve, posterior cutaneous nerve of thigh, a chain of vascular anastomosis at the back of adductor magnus. There is no major artery in the back of thigh as the hamstrings and short head of biceps femoris are supplied by perforating branches of profunda femoris artery. Characteristics of hamstring muscles. To be classified under hamstring group, the muscles must have the following features. The muscles should take origin from ischial tuberosity. The muscles should be inserted beyond knee joint into either tibia or fibula or both. The muscles should be supplied by tibial part of sciatic nerve. The muscles should act as extensor of hip joint and flexor of knee joint. Only two muscles, semimembranosus and semitendinosus, fulfill and satisfy the above criteria and are called true hamstrings. Long head of biceps femoris and ischial part of adductor magnus are called modified hamstrings because of the following reasons. The long head of biceps takes its primitive origin from ilium and sacrum, and this is subsequently shifted to the ischial tuberosity, leaving behind the sacrotuberous ligament as its morphological remnant. Ischial part of adductor magnus is primitively inserted into the medial condyle of tibia. This is subsequently shifted to adductor tubercle of femur so that the tibial collateral ligament represents its diversed primitive insertion. Before we proceed to the details of the muscles, let us understand the parts of ischial tuberosity, which is important to understand the muscle attachments. The ischial tuberosity is divided into upper quadrilateral and lower triangular areas by a horizontal line. The upper quadrilateral area is further divided into two parts by an oblique line into superolateral and inferomedial parts. The lower triangular area is further divided into two parts by a vertical ridge into medial and lateral parts. Now coming to the details of the hamstring muscles, let us start with semimembranosus, which is so called because it splits into membranous slips at its insertion. Semimembranosus originates from the superolateral part of quadrilateral area of ischial tuberosity by a broad flat tendon which passes deep to the long head of biceps femoris. It is membranous in the upper half and becomes fleshy in the lower half, upon which cord-like tendon of semitendinosus rests. The fleshy part of the muscle ends in a cylindrical tendon which forms the superomedial boundary of popliteal fossa and is inserted mainly into a horizontal groove at the back of the medial condyle of tibia, deep to tibial collateral ligament of knee joint. Sometimes a bursa intervenes between the bone and tendon. From the insertion, it gives three tendinous extensions or expansions. Oblique popliteal ligament of knee joint, which extends upwards and laterally behind the fibrous capsule of the knee and is attached to the intercondylar line and adjacent lateral condyle of femur. Few fibers extend over the popliteus muscle downwards and laterally, forming the fascia covering popliteus and gets attached to soleal line of tibia. And a slip is attached to the deep fascia of leg through which it reaches the medial border of upper part of tibia behind the medial collateral ligament. Semitendinosus is named so because it has very long tendon that begins in mid-thigh. The semitendinosus originates from the muscular impression on the inferomedial part of quadrilateral area of the ischial tuberosity in common with the long head of biceps femoris. It is fleshy in the upper part and forms cord-like tendon in the lower part which rests on semimembranosus muscle. The long tendon travels forming the superomedial boundary of popliteal fossa, then runs behind the medial condyle of femur and curves forward and downwards for insertion into the upper part of medial surface of tibial shaft behind the insertion of sartorius and distal to that of gracilis. Thus, three muscles representing three compartments of thigh are inserted into the upper part of medial surface of tibia. Sartorius is from anterior compartment, gracilis is from medial compartment, and semitendinosus is from posterior compartment of thigh. Biceps femoris has two heads. The long head is a modified hamstring muscle, while the short head does not belong to a hamstring group because it does not fulfill any of the criteria of hamstrings. Morphologically, short head represents the extensor muscle and appears in the flexor compartment for functional reasons. The long head takes origin from the muscular impression on the inferomedial part of the quadrilateral area of ischial tuberosity along with semitendinosus. The short head takes origin from the lower part of lateral lip of the linea aspera and from the upper 2/3 of lateral supracondylar line of femur. The long head passes obliquely downwards and laterally to meet the short head of biceps femoris on its deep surface. The sciatic nerve passes between the two heads of biceps femoris. The two heads unite in the thigh and form a tendon runs downward and laterally, which can be palpated in the superolateral boundary of popliteal fossa. The tendon splits around the fibular collateral ligament and is inserted into the head of the fibula in front of styloid process and provides a slip of attachment to the lateral condyle of tibia across the superior tibiofibular joint. Adductor magnus is a composite muscle and is formed by the fusion of adductor part of the medial compartment and ischial part belongs to posterior compartment. The adductor part takes origin from the ischiopubic ramus and is inserted into the linea aspera. It will be dealt in detail along with adductor compartment of thigh. The ischial part of adductor magnus is located posterior to the adductor part. The muscle takes origin from the inferolateral part of the triangular area of ischial tuberosity. From the origin as tendinous part, the muscle passes vertically downwards to form a rounded tendon in the lower third of thigh and gets inserted into the adductor tubercle of the femur. It can be palpated proximal to its insertion into the adductor tubercle of femur. This part primitively is inserted into the tibia directly, but later the lower part of the tendon degenerates and forms the tibial collateral ligament of knee joint. Because of this, it is called modified hamstring muscle. The fifth osseo-aponeurotic opening of adductor magnus for the passage of femoral vessels intervenes between the two parts. Hence, the continuity of posterior intermuscular septum of the thigh is disrupted. The nerve supply to all the muscles of the back of thigh are supplied by the tibial part of the sciatic nerve or tibial component of the sciatic nerve, except for the short head of biceps brachii, which is supplied by common peroneal part or component of sciatic nerve at the lower level. Mentioning the tibial part and common peroneal part of sciatic nerve is very important during discussion of nerve supply to the muscles. Actions of hamstring muscles. The hamstring muscles extend the thigh at the hip joint and flex the leg at the knee joint, especially in standing, walking and exercising. With the knee semi-flexed, the biceps femoris acts as lateral rotator of the knee and the semitendinosus and semimembranosus act as medial rotators of knee joint. Short head of biceps femoris acts only on the knee joint. It acts as flexor of knee joint. Now, testing the function of the hamstrings. While testing the hamstring muscles, the subject lies prone with knee extended. The subject is asked to flex the knee against resistance in this position. If the person is able to flex the knee against resistance, then the hamstrings are normal in functioning. The nerve of the compartment is the sciatic nerve. The sciatic nerve is the thickest nerve in the body. It is about 1.5 to 2 centimeters wide. It extends from the pelvis to the upper angle of popliteal fossa at the level of the junction of lower and middle thirds of thigh, where it divides into terminal branches, tibial nerve and the common peroneal or common fibular nerve. It supplies the muscles in the posterior compartment of thigh, and through the terminal branches, it supplies all the muscles of the leg and foot. It has wide sensory supply, which includes the entire leg and foot except the area supplied by the saphenous nerves. The sciatic nerve is the largest branch arising from the sacral plexus. Root value of the sciatic nerve is formed by ventral rami of spinal nerves from the fourth lumbar to the third sacral spinal segments in the pelvis in front of the piriformis muscle. It has two components which are enclosed in a common connective tissue covering. The medial half of the nerve forms the tibial component. It consists of ventral divisions of the ventral rami of spinal nerves arising from the fourth lumbar to the third sacral spinal segments. The lateral half of the nerve forms the common peroneal component. It consists of dorsal divisions of the ventral rami of spinal nerves arising from fourth lumbar to the second sacral spinal segments. Only after division of the sciatic nerve into terminal branches at the superior angle of popliteal fossa, the components are called as the nerves. In the posterior compartment of thigh, the sciatic nerve enters the compartment by emerging out from the lower border of gluteus maximus and passes straight down on the adductor magnus deep to the longate of biceps femoris up to the superior angle of the popliteal fossa. So the relations of the sciatic nerve in the back of thigh are anteriorly it is related to the adductor magnus and posteriorly it is related to the longate of biceps femoris which crosses the nerve from medial to lateral side. It terminates at the upper angle of the popliteal fossa by dividing into tibial and common peroneal nerves. Sometimes the division of the nerve takes place in the pelvic cavity. In such case, the tibial nerve emerges below the piriformis and the common peroneal nerve pierces the piriformis. The branches of the sciatic nerve in the thigh are muscular branches which arise from its medial side or tibial part to supply the long head of biceps femoris, ischial part of adductor magnus, semitendinosus, semimembranosus. Muscular branch arises from its lateral side or common peroneal part to supply the short head of biceps femoris. Therefore, the medial side of sciatic nerve is considered as the dangerous side since many muscles are supplied from the medial side and lateral side is considered as the safe side because only one muscle is supplied from the lateral side. The nerve receives a special artery called companion artery of sciatic nerve called arteria nervi ischiatica, which is a branch of inferior gluteal artery. This artery runs in the substance of the sciatic nerve. When the sciatic nerve is cut in the amputation of the thigh, the artery is secured and ligated to avoid profuse bleeding. Its embryological importance is that it is an example of the axis artery of lower limb. Coming to the surface marking of sciatic nerve, to represent the sciatic nerve in the back of thigh, 2 points are marked. The first point corresponds to a point midway between the greater trochanter and ischial tuberosity. The second point is marked at the upper angle of the popliteal fossa at the junction of upper 2/3 and lower 1/3 of the thigh. Join the two parts vertically downwards, which represents the sciatic nerve in the thigh. Coming to the blood supply, the blood supply to the back of thigh is through the linear arterial anastomosis. The back of thigh does not have its own artery to supply the structures. The arterial anastomosis on the back of thigh are from above downwards trochanteric anastomosis, cruciate anastomosis and longitudinal anastomosis. Trochanteric anastomosis is situated near the trochanteric fossa of femur and provides branches to head of femur. Arteries participating in trochanteric anastomosis are descending branch of superior gluteal artery arising from internal iliac artery, ascending branch of lateral circumflex femoral artery, ascending branch of medial circumflex femoral artery, a branch from inferior gluteal artery arising from internal iliac artery. Cruciate anastomosis is situated over the upper part of the back of thigh at the level of middle of the lesser trochanter of femur. Arteries participating in cruciate anastomosis are transverse branch of medial circumflex femoral artery, transverse branch of lateral circumflex femoral artery, descending branch of inferior gluteal artery arising from internal iliac artery, ascending branch of first perforating artery arising from profunda femoris artery. Longitudinal anastomosis is located close to the adductor magnus on the posterior aspect of femur. A chain of longitudinal arterial anastomosis is formed by the following arteries: ascending and descending branches of 4 perforating branches of profunda femoris artery, and the ascending branch of first perforating artery takes part in the formation of cruciate anastomosis, and the descending branch of the 4th perforating branch anastomosis with the muscular branch of the popliteal artery. So overall, the blood supply of the back of thigh is supplied by linear chain of arterial anastomosis. From above downwards, it is the trochanteric anastomosis, then the cruciate anastomosis and longitudinal anastomosis, which supplies the structures in the back of thigh. Till now, we have seen the normal anatomy of back of thigh. Now, in the next few slides, let us see some of the clinical aspects. Pulled hamstrings. The professional runners are prone to this painful condition in which the attachment of hamstrings to the ischial tuberosity is torn. The extension of hip and flexion of knee is essential for running. So the runners are liable to overstrain these muscles. Sciatica is caused by compression of the lower lumbar and upper sacral nerve roots or by pressure on the sacral plexus. The patient experiences radiating pain down the posterior aspect of thigh, posterior and lateral sides of leg and the lateral part of foot. The sleeping foot is due to temporary compression of the sciatic nerve against femur at the lower border of gluteus maximus when a person sits on the hard edge of a chair for a long time. For anesthetic block of sciatic nerve, the site chosen for injection is a few centimeters inferior to midpoint of the line joining posterior superior iliac spine and apex of greater trochanter. Effects of injury to sciatic nerve in the posterior dislocation of hip joint are as follows. Paralysis of the muscles of posterior compartment of thigh, posterior compartment of leg and foot. Sensory loss below the knee with sparing of the skin supplied by saphenous nerve and deep peroneal nerve. With this, we have completed the back of thigh. Thank you for watching till the end. If you like the video, like, share and subscribe to the channel. It might help and benefit others also who are in need.